Hello, I'm Dr. Bridget Nash, and I'd like to welcome you to The Therapy Show, a podcast series that seeks to demystify mental health treatment. Today, I'm honored to welcome Dr. Michael LaSala, who is the director of the DSW program and an associate professor in the School of Social Work at Rutgers University. His research interests are in couple and family relationships of gay men and lesbians. Dr. LaSala has published extensively in peer-reviewed professional journals, and his current work examines the role of gay and lesbian family relationships in coping with stigma, as well as parental influence on gay youth's safe sex behavior. He is the author of Coming Out, Coming Home, Helping Families Adjust to a Gay or Lesbian Child, which describes the findings and practice implications of a National Institute of Mental Health funded qualitative study of 65 gay and lesbian youth and their families. Dr. LaSala has been practicing social work for 30 years at the direct practice, supervisory, and administrative levels. Because of his commitment to practice-informed research, he continues to practice part-time as a licensed clinical social worker at the Institute for Personal Growth in Highland Park, New Jersey. Dr. LaSala, welcome to The Therapy Show.
Thank you for having me.
Can you start by telling us a little bit about your personal background and professional development that led to your research and practice in the field of gay and lesbian family therapy?
Sure. I learned family therapy at the very start of my social work career many years ago. I worked for a home-based foster care prevention agency where we went into people's homes and did family therapy, where the family was at risk of disbanding due to child abuse or child neglect or the child's behaviors. My boss at the time brought in trainers from the Philadelphia Child Guidance Center. Now, the 1980s were the golden age of family therapy, and Philadelphia Child Guidance was at the epicenter of practice and teaching and research. So we were very fortunate to have somebody come from Philadelphia Child Guidance Center to train us. Now, the more I learned about family development, the more questions I had as to how the theories at the time applied to families in which a gay or lesbian person was coming out. For example, we know that as a child goes from adolescence to late adolescence to early adulthood, the child must become increasingly autonomous while staying in connection with the family of origin. And the family needs to support that balance in a reciprocal manner. In other words, they need to loosen their boundaries and support the child's growing independence while still maintaining meaningful contact. That is the developmental phases of adolescence and young adulthood. So through my career as a therapist and as a family therapist, I started to wonder, how does that process, that family development process, work in a family where a child was coming out as gay or lesbian? Most kids come out during adolescence or during young adulthood. So what effects does that have, and how might we need to think differently about family development for these very families? And that question led me to my research and my current practice.
So how would you briefly explain gay and lesbian family therapy to a non-professional?
It is family therapy. Let's start with that, which means meeting as a family, or at least parents and the gay or lesbian person as a group. And because it's family therapy, our target of intervention is the relationships between people, not necessarily the individual themselves, but more what's going on between people. That's where we assess and that's where we intervene. Now, I happen to specialize in working with families where a child is coming out as gay or lesbian, or even trans. I do work with trans families as well. But family therapy is also used if a parent is LGBT. So that would still be considered gay and lesbian family therapy. Now, the therapist doesn't have to be gay to do this work, but they do have to be informed about the special, unique issues these families face, such as the risk of rejection on the part of the LGBT person, the mental health vulnerabilities of this population, as well as their physical health needs.
Dr. LaSala, in your book, Coming Out, Coming Home, Helping Families Adjust to a Gay or Lesbian Child, you outline effective practice-tested interventions for families. Can you share a little bit about how you came to this work and why it is an important focus in delivering effective therapeutic interventions?
Well, repeated research strongly suggests that the rates of mental illness and addiction among lesbian and gay youth and also transgender youth are proportionally higher than their non-LGBT counterparts. So we know that these youth are at increased risk for suicidal behaviors and thoughts, suicide in and of itself, depression and anxiety. However, the rates are lower among youth who are LGBT who report family support. So, of course, I really wanted to explore how families adjust. How do they go from that initial shock of learning that their child is gay to eventual acceptance with an eye towards providing milestones and tips to clinicians and families struggling with this issue? I thought they could benefit from the stories from my research respondents, and clinicians could encourage families to incorporate the coping strategies and techniques that my research respondent families had utilized.
So does a therapist need specialized training in this framework before they begin treating clients? I know you mentioned that they don't have to be gay or lesbian themselves, but do they need specialized training?
Yes, or at least good supervision and or consultation, regular consultation from someone who has knowledge in this area. Some of the techniques are the same that any family therapist would use. For example, engagement. You have to engage each member of the family and thus engage the family system. The use of enactment is also something that would be used with families of LGBT youth. Enactment meaning getting family members to talk to each other about charged issues in the presence of the therapist, who then coaches them to find ways to interact that are productive and healing. And also, just as any family therapist would do, you would use reframing as a technique, taking problematic or conflictual issues and finding new meanings that can result in solutions. For example, youth come out to their parents because they want honesty in their relationships and acceptance. And here are some special issues with LGBT families. The youth want this kind of new relationship or strengthened relationship with their parents, or they want relief from some of the stress that they're dealing with from having an LGBT identity. However, parents, when they first hear that a child is gay or lesbian or transgender, they feel angry, guilty, anxious, and worried. So when their children come out and are looking for some kind of relief and support, parents aren't always available to offer that. So the therapist in these circumstances may need to see parents and children separately, which in some ways violates one of the cardinal rules of family therapy. But this is not long-term. It's just done initially, and it's done so that parents can vent their concerns, their emotional upsets, away from earshot of their children, who don't really need to hear this, and it's not helpful for them to hear it. Their children might see that parental reactions are ultimately based on love and caring for them, particularly if the therapist reframes parental reactions or parent-child conflict as concern and love, even if parents are misinformed about gay lifestyles. So those are some of the special techniques that a clinician would need to add to their repertoire when working with these families.
So from your experience, what clinical issues do you see in gay and lesbian family therapy?
For the most part, I see guilt, I see mourning and worry among parents of LGBT youth. Parents often feel when they first learn that their child is gay or lesbian or transgender that they've done something wrong. And I'm afraid this comes from the history in psychiatry, where in the 50s, it was believed that a family created a gay male through their family dynamics, namely a close binding mother and a distant father. And since the 50s, that idea has been disproven over and over again. There is no evidence that family dynamics creates a child with an LGBT identity. However, it still lingers in people's minds. So that is often the first place parents go. Parents also begin to mourn a loss, in a way, with their children. When they hear that their child is LGBT, they become concerned that their child is never going to have a wedding, never going to get married, never is always going to be alone, is never going to give them grandchildren, all of which is not necessarily true. but that's where parents' minds go. And parents also worry about the stigma that their children are going to have to experience and wonder or even doubt that their child, as an LGBT person, can live a happy and productive life. So those are the things that parents come to therapy with when they bring their families. Among the youth feel hurt by their parents' reactions. They feel betrayed and they're impatient. They may understand that their parents can adjust to this, but they want things to move much more quickly. So those are the clinical issues. I would say that in my clinical experience, parents who are going to have the toughest time are parents who are having trouble letting go of the guilt that they feel. That if they continue to feel like this is a bad thing and it happened because they did something wrong, I find that they're more prone to mental health issues like depression and anxiety.
And we talk about these clinical issues, but oftentimes this person didn't have a clinical issue, but now these clinical issues are due to the experience. Does that make sense?
Or even beforehand. What I find is that among youth or people who are LGBT, they've often experienced trauma related to growing up as a child who has an LGBT identity. Often these children show cross-gendered behaviors as children, and their peers will bully. One of the big offenses a child can do, particularly a boy, is to act like a girl. And peers can be merciless when it comes to bullying. So I think that societal information that these youth are absorbing from society and from their peers is what puts them at risk for anxiety and depression and the other mental health issues that I've talked about. Then on top of that, they're feeling isolated from their families and feeling as if both the bullying and the reason for the bullying needs to be kept from the parents. So let's just put ourselves in the shoes of these youth. Imagine that you're being made fun of, taunted by your peers, being called even slurs, anti-gay slurs, before you even recognize that that's who you are. And then once you recognize that you are gay or lesbian or transgender, and in fact, you are the things that those bullies are saying, and then you have to keep it to yourself, you have to keep it hidden, you can see the level of stress that these youth are carrying with them. So I hope that answers your question.
That was powerful.
Mm-hmm.
And yes, I can definitely see that that's a tremendous amount of stress that is caused by the outside stressors.
But there's some good news related to that as well. During family therapy, by the time a child has come out to their parents, they've already been dealing with some of these stressors, some of the stressors that parents are worried about. So I have found that when I can get parents and kids calm enough to talk to each other, a parent will say something like, well, I'm worried you're going to be discriminated against. And what I find is that the child has already been living with that. And if we're fortunate, the child has already found ways to negotiate those things so that, they're already, for better or worse, they're already a good student when it comes to how they cope with, they become experts. Maybe that's a better way of putting it in terms of how they cope with stigma by the time they come out to their parents.
That makes a lot of sense. Are there safety concerns that families face?
Yes, for sure. There are concerns around safety and also around health. Gay males and trans people in particular are at higher risk for STDs, including HIV, HPV, and hepatitis. We know that also lesbians and lesbian youth are at particularly high risk for substance abuse and especially alcoholism. In addition to that, as I've stated previously, these youth are also more prone to suicidal thoughts and suicidal behavior, self-harm, and depression, anxiety. And as a group, they're at higher risk for abuse of substances. I have found that retrospectively, these kids have talked about feeling suicidal before they came out to their parents. And if they come out to their parents and they're not rejected, not necessarily accepted, but if they're not rejected, their suicidal feelings decrease dramatically. And again, we're not talking about the parents don't have to necessarily accept it initially. The big fear is that they're going to be rejected and maybe that they need to leave their homes. I have seen clinical situations where parents become very rejecting after the child comes out. And that also puts them at higher risk for suicide and self-harm. So if the disclosure goes poorly, that's extremely problematic. And we need to really, those of us who work with youth individually need to really monitor them at that point.
So what's the average length of treatment for somebody working with a trained gay or lesbian family therapist?
That's a really difficult question to answer. It varies. You know, when people ask in general how long therapy is going to take, I say, well, that reminds me of during one of my travels, somebody asked me for directions and they said, how long will it take to get there? And my response was, well, let me see how fast you walk. So it really depends on how fast the family is moving in terms of adjustment. I have found that families generally need the most help around the initial coming out. And then again, if and when the child gets a partner and wants to bring that partner home into the family, that those are key times when the family needs support.
So what skills, habits, or tactics can clients adopt either during their sessions or in between sessions to improve the effectiveness of their therapy?
Well, first and foremost, I think they need to nurture and maintain a sense of hope. I've seen many, many families start out troubled after the initial coming out incident or period, but grow stronger and closer than ever before as a result. And as a result of the trajectory that they go through when the child comes out. Things might feel badly initially, but they often get better. And there's definitely light at the end of the tunnel. Now, parents can do things to educate themselves. I mean, that's a must. They need to learn more about the lives of LGBT people, and they need to have some of the myths that they have adopted from society. They need to have them dismantled and deconstructed. In my study, in my research, and somewhat in my clinical practice, I found that parents who recovered quickly found confidants, people outside of the family who they could talk to and who could guide them through the process and who could support them. So perhaps a coworker with a liberal orientation, or maybe a mother's hairdresser who she happened to know was gay, but someone with whom they could vent and talk about their feelings about having a gay kid or a lesbian kid. And that through these conversations, I found in my research, parents come to the point where they realize three things. One, this is not their fault. Two, they can't change it. And three, if they don't accept it, they'll lose their child. And once parents get to the point where they understand those three things, they're on the road to recovery.
So what are the most common obstacles that prevent clients from seeing the full benefit of therapy?
Number one is excessive guilt. I find that parents who really have trouble letting go of guilt around the sexual orientation of their children or of their child are parents who are much more likely to experience profound depression and anxiety and problems with self-esteem. They really, really feel like failures. They feel like what's happening to their child is awful, or who their child is or what they're coping with is absolutely awful, and it's all their fault. And so how can a parent feel good about that? So that's definitely an obstacle. Parents really have to work, and we as clinicians really have to work hard and be really persistent and tenacious in helping parents resolve and let go of their guilt. Another big obstacle is religious concerns. I've spoken on this topic all over the country. And at one point, I was giving a talk in South Carolina to clinicians. The big question was, what do we do with Southern Baptist families who have parents who believe that if a child is gay or lesbian or transgender, they're going to burn in hell. Now, I don't have an easy answer to that question. My experience, first of all, I think we have to empathize with those parents, because I think I can't imagine what it's like to be a parent and think that your child is sentenced to an eternal damnation. And of course, you'd want to do everything you can as a parent to prevent your child from experiencing that fate. And I get it. And maybe that's where, as clinicians, we need to start with families who have religious concerns. But I've also counseled families, and particularly parents, in this way. I have found in my research and my practice experience that if a parent or even a gay or lesbian person themselves observes a religion or participates in a religion that happens to be very anti-LGBT, a number of things can happen. They have a number of choices. Number one is they could become what is euphemistically known as cafeteria Catholics. And again, I think this idea can spread beyond Catholicism. In other words, they can believe and accept the sacraments. They attend mass on a regular basis, but they don't agree with all of the dogma. They may not believe in the Catholic Church's stance on same-sex marriage, and perhaps they don't believe in the Church's stance on birth control. So in other words, they pick and choose what's most meaningful for them spiritually and then put aside or ignore the rest. The other choice is to find a religious community that is more accepting and more accepting of alternative lifestyles. Like I have friends and I've seen clients who were raised Catholic but became Episcopalians, for example, or Unitarians. And parents can do that as well. So to find another place to worship is another choice that parents can make. Or sometimes, and I think this is rather sad, I've seen LGBT people and parents leave religion altogether as they try to figure this out and they try to support each other. So those are the choices that families have. And I simply lay them out. I can't tell families, either parents or LGBT youth, which path they should take. I just say, here are the possible paths. And, this is a journey and you will figure it out as time goes on. What's best for you?
So can you share any poignant examples of where working with the gay and lesbian family therapy framework had a major impact in someone's life?
Yes, I have seen many, many times children and parents become closer than they ever have been as a result of the coming out experience. And I try to tell that to all of the families I work with, especially when they first come in and they're dealing with all the turmoil and the arguments and the tears and the distress. So I've had situations where, for example, a father, months after his lesbian daughter came out to him, became closer to her as a result. They had more contact, more family discussions, and he relayed to me in my research in tears that he never thought he'd be able to have this kind of relationship with the child. What happens is when a kid comes out and parents don't reject them, and parents actually make an effort to try to learn about the child's lifestyle and to become more accepting, children see that. And then they feel not only relief, but they start to feel like they want to be closer to their parents who are doing all this work. And after perhaps they've been bullied as a child or they've held on to the secret for a long time, there's this great sense of relief. And there can be a great sense of gratitude towards parents. And most parents I know, when they're late adolescent or young adult, looks as if they want to spend more time and want to be closer. That's like catnip for them. They welcome. I've had parents say, well, not so sure about the gay or lesbian thing, but my kid seems happier and they want to spend more time with me. So I guess this is a good thing. So that helps things along.
That is actually true. For me, especially.
I've seen parents grow through this process. And I've seen one of the remarkable things is when parents, sometime during the therapy or during their adjustment period, particularly if the parents are white and middle class and maybe have never experienced any kind of oppression or stigma or discrimination, by having a child who is gay or lesbian or transgender, they get plunged into this world where they start to realize that, life isn't always fair, and you can be judged and discriminated against based on something as ridiculous as your sexual orientation. And I've seen parents who are white then go from there and start to empathize with other oppressed groups and have a sensitivity about racism, sexism, ableism that they hadn't had before. So that's another really interesting positive outcome that can come from having a child or working with families where a child is coming out.
Is there anyone who gay and lesbian family therapy would not be appropriate for?
Well, I think there are situations where it's not appropriate. Let's put it that way. So number one is the child really needs to be out. A family therapy session is not the place for a child to come out, nor a place for parents to confront their children about their sexual orientation or gender identity, because that can seem like an ambush that involves the therapist. So we want to avoid anything that seems like an ambush. Such discussions need to happen in a relaxed setting outside of the session. And frankly, I usually dissuade parents from confronting their children if they have suspicions. I know lots of situations where that's gone okay, but I also know situations where parents have confronted children and it hasn't gotten so well because the child wasn't ready. So I've seen it backfire whereby a parent will say, you seem gay to me. Are you gay? Something along those lines. And the child would be like, wait a second. How can you tell? I thought I was hiding it. I'm not ready for people to know. And they can feel incredibly vulnerable and exposed. So under those circumstances, I coach families to create an accepting environment that gives the child the message that it's okay to come out if and when ready. So for example, casual conversations around topical gay issues, such as talking about up to recently, talking about the Buttigieg presidential campaign, maybe casually slipping in some mention of support for same-sex marriage, those kinds of things. Having maybe some literature, not overdoing it, but some literature around the house that indicates support and acceptance for LGBT lifestyles. So in other words, creating an environment so the child knows when and if they're ready, the family has its catcher's mitt on and is ready to be accepted.
So Dr. LaSala, what are you most excited about in mental health treatment today?
That's a really interesting question. I would say I'm really excited about the integration of spiritual perspectives in psychotherapy. And in general, how it relates to working with LGBT families is in this way. Many people don't know this, but many indigenous cultures from just about every continent, Asia, Africa, North America, in these cultures, being gay or trans, or in some ways demonstrating cross-gender feelings or behaviors, is evidence of a special holiness, and also that person is believed to be channeling healing powers. So in these cultures, they believe that LGBT folks, and a little bit of a disclaimer, they probably don't classify these people in the same way. I know among Native Americans, often the term used is two-spirited. But anyway, there's the belief that if a person shows masculine and feminine behaviors, that they are chosen by God and they are given healing powers. And they hold special positions, not only within their families, but within their tribes. So I think that's an interesting finding, and it says something about how cultural positions can certainly bias the way we think about gender identity and sexual orientation and gender expression.
If you had a magic wand and could improve one thing about the mental health system, what would that be?
I would make mental health services, and particularly psychotherapy and family therapy, free for everyone.
I like that.
Absolutely. For everybody. Why not? It's happening in other countries. I believe my friends in Sweden who are therapists, I think every citizen in Sweden gets like 25 sessions a year. Why can't we do something like that?
I completely agree. So Dr. LaSala, how can my audience learn more about your work, either online or in print?
Okay. So of course, you can start with my book, Coming Out, Coming Home. It's put out by Columbia University Press. You could quickly find it on Amazon by plugging in my name and plugging in the title. Also, my blog post on Psychology Today, I have over 35 entries and lots of responses. So I would advise people to look at that and you'll get a good sense of how I think and how I work.
And all of that information will be on therapyshow.com website under LGBTQ plus therapy, under the page dedicated to Dr. LaSala's work. Dr. LaSala, on behalf of myself, my listeners, and all of the people you have helped through your work, I want to thank you for your contributions to mental health treatment and for taking the time out of your busy schedule to help me and my audience better understand the field of gay and lesbian family therapy.
It's been my pleasure, and I love the Therapy Show.
Thank you. Be sure to check out my website, therapyshow.com, which has many resources about mental health. There you'll also find how to contact me to submit questions, personal stories, and insights about the mental health system, suggestions about who else I can interview, or how I can improve the show. So I'd like to close by reminding our listeners to please subscribe, share, and review this podcast so you, someone you love, and people around the world can gain more benefit from therapy. There is no need to suffer in silence. Get the help that you need to create the life that you want.